Welcome to this series of videos on vitamin D and its importance for the immune system. In this video, I am going to talk about results from recent papers, relatively recent papers, published in the last 2 years, which try to correlate the vitamin D deficiency to the severity of COVID-19 symptoms. It is well known that vitamin D, besides being a vitamin, is also a hormone, and it has very clear immunomodulatory activities, which means that it can act on the immune system, the innate and the adaptive immune system as well. And there are many studies now that have shown this and which discuss these properties. And this is, for example, a review which was published in 2020 discussing this. Michael Holick, who is a very well-known actually expert on vitamin D, who works at Boston University. And I'm not going to go through all the details of this review, although it has a lot of very interesting facts and results. But what I want to take from this review is that a lot of studies now have shown an association between low levels of vitamin D in the 25-OHD form, which is a circulating form in the blood, and an increased risk of developing several immune-related diseases. Okay, and this can include a lot of different things. It can include diabetes, sclerosis, arthritis, tuberculosis, respiratory infections, including COVID-19, and a lot more. So there is really a lot of evidence now that vitamin D is really important for the immune system. So let's have a look at what some recent papers tell us about the association between low levels of vitamin D and the severity of the COVID-19 disease. In this first study, the authors wanted to see if there is any possible correlation between vitamin D levels and disease severity in these patients, COVID-19 disease, okay? So the number of patients in this group is relatively small, 42 patients. All of them had already acute severe distress syndrome. So they were already quite sick and they had clear respiratory diseases. And we can see here the details of this group of patients. The mean age was 65 years old. And if we go down the list here, we can see that their average vitamin D serum level, 25-OHD blood level, was 20.4, roughly 20.5 nanograms per milliliter, which is relatively low. Okay, let's face it, this is low. The number of patients which had a vitamin D level below 30 nanograms per milliliter, which is considered insufficient, was 34, which is 81%. Okay, so 81% of these patients had an insufficient level of vitamin D in their blood already. About a fourth of these patients had a severe vitamin D deficiency with less than 10 nanograms per milliliter, which is very, very low. Now it's interesting because this study was done in the south of Italy, in Bari, a place where there is a lot of sun. It's fairly close to the sea, and people can in principle get a lot of sun and synthesize vitamin D all year long. However, in this study, 81% of them had severe vitamin D deficiency, so it is very interesting. And this also reflects a lot of other studies which have measured the vitamin D blood level in people living in sunny countries, not just in Europe, but also in the Middle East, in India, in South America. And they also found a high number of vitamin D deficiency, a high percentage of people with vitamin D deficiency. This is another topic, and I will discuss this. This is very interesting. I will make videos on this. Let me know in the comments below if you're interested to know more about this. I think it's a very, very important and interesting topic, because we oftentimes make the assumption that if you live in a sunny country, if you go outside in the summer when it's sunny, you can synthesize vitamin D, and therefore you don't need any more vitamin D, or you synthesize enough vitamin D. Well, guess what? Studies, and many, many different studies now, have shown that it is not the case. And people who expose their skin to the sun and who live in sunny climates can be vitamin D deficient, and actually a lot of them may be vitamin D deficient. There are several reasons for this, And I think it's worth discussing some of them at least, okay? Discuss some of them because there's a lot of assumptions which are made but which are not verified. And these studies will show you that the assumption that being in the sun is enough to produce enough vitamin D is simply not correct. One of the most important results of this study is right here. After 10 days of hospitalization in these patients which had severe acute respiratory distress, patients with severe vitamin D deficiency had a significantly higher mortality risk than others. And this is shown in this graph here, where you can see the survival rate as a function of the days of hospitalizations, but also as a function of the vitamin D status, either below 10 nanograms per milliliter or above 10 nanograms per milliliter. And we can see that the survival rate of the people with a low vitamin D below 10 nanograms per milliliter is significantly lower than the ones which have a level above 10 nanograms per milliliter, which is a low number, okay, which is low and which is nowhere near the optimal range. 10 nanograms per milliliter is very low. If you want optimal vitamin D level, you need to go much higher. Recommendations are oftentimes 30 nanograms per milliliter, which is also considered by many people way too low. So you really want to go even higher than that, 40, 50, and sometimes even more. But that's another topic we can discuss about in a different video. And that's what they recommend also in this paper here, as you can see. They recommend that people at risk of influenza or COVID-19 disease take a supplementation of vitamin D to raise their 25-OHD concentration above 40 to 60 nanograms per milliliter. And in conclusion, the results of this study show that there is a high prevalence of hypovitaminosis D, which is a low level of vitamin D in COVID-19 patients treated in this center, in this hospital. Higher risk of mortality was found in patients with severe vitamin D deficiency. And it is also worth noticing that the association between a low level of vitamin D and inflammation and respiratory diseases and an increased risk of respiratory infection also started much before COVID-19. There's been a lot of studies on this, large number of studies that show the efficacy of vitamin D and of increasing your level of vitamin D to prevent or reduce the severity of respiratory diseases. The prevention part is a little bit unclear. There is a lot of debate about this. One thing that is clear, however, is that increased levels of vitamin D really help to reduce the severity of either COVID-19 or other respiratory infections and diseases. Other studies have also reported that vitamin D can help reduce the risk of influenza and COVID-19 as well. I'm going to show you now another short study where they show a correlation between vitamin D status and mortality and number of COVID cases. This paper is one of the early papers that came out during the pandemic, and it is a short communication in which the authors tried to establish a role between vitamin D and prevention of coronavirus disease COVID-19. And here they especially look at the number of COVID-19 cases and also mortality due to COVID-19. Here they looked at a lot of different countries in Europe from north to south, so with varying degrees of sun exposure. And they looked at the vitamin D blood level in the population of these countries. Now, as you can see in this column here, there is a large variation in the level of vitamin D, blood level of vitamin D in nanomoles per liter, okay? The numbers are in nanomoles per liter, which is different from nanograms per milliliter, okay? This can be confusing, but there is a factor of 2.5 between the two units. So you have to be careful about that. If you wanted to know how much it is in nanograms per milliliter, you would have to divide by 2.5, okay? So for example, for Italy here, which has 50 nanomoles per liter, this would be 20 nanograms per milliliter, which is considered insufficient, just at the borderline insufficient, which is very surprising. Spain, another sunny country, has even lower levels of vitamin D. Estonia, which is in the north, has actually a higher level than Spain and even a bit higher than Italy. Interesting, right? Iceland, Norway, Sweden, Finland all have higher levels of vitamin D than several of the southern countries. Very, very interesting indeed. There are reasons for that, and we can talk more about this. This was also shown in a study, the Seneca study, which showed that a mean serum vitamin D level of 26 nanomole per liter in Spain, 28 in Italy, and 45 in the Nordic countries, so higher in the Nordic countries in older people. This is something to bear in mind. It's not because you live in a sunny country, I already said that before, but sun does not necessarily mean high vitamin D blood level, okay? And oftentimes, it's actually not true. It's the opposite. Now, one of the most interesting results of this study is this graph here. In this graph, we can see the mean vitamin D level per countries versus COVID-19 mortality. And they observed a negative correlation, as you can see here, which means that the countries which had the higher level of vitamin D had the lowest mortality rate. Okay, lower mortality rate, which is indicated here per million people in the population. They also observed a very similar negative correlation when they looked at the number of COVID cases. As you can see here, negative correlation as well. So this is very telling, and of course, you can see there is some scatter in the data. This is of course because vitamin D is not the only parameter which you have to take into account. That's one parameter, but there are many others. And this is a correlation, which does not mean there is necessarily a cause to effect relationship. Okay, that's something important to remember. But in this case, many studies have shown now a beneficial effect of vitamin D on the outcome of severe diseases, severe respiratory diseases such as COVID-19 and also influenza. And here they write that not everyone is going to benefit in the same way from the same amount of vitamin D supplementation. Okay, that's something important to remember. Not everyone will benefit in the same way. There's no one size fits all. I said that in a previous video, but that's shown to be true here as well. There's not a one-size-fits-all in terms of vitamin D supplementation. The people who had the most severe vitamin D deficiency experienced the most benefit. Okay, so that's something to keep in mind. In their conclusion, the authors write that they found a significant crude relationship between vitamin D levels and COVID-19 cases and especially mortality. And we saw this negative correlation between vitamin D levels and mortality and vitamin D and also number of COVID-19 cases in all these different European countries. So this is one of the main results of this paper. And we're going to explore a lot more in the coming videos. So stay tuned. If you liked this, please let me know in the comments below. Like the video, subscribe to the channel, comment. Let's have a discussion on this. What is your experience with vitamin D? Do you take vitamin D supplementations? How often do you expose your skin to the sun in the spring, in the summer? Let us know where you live also, because that's quite important. And let us know if you have been infected by COVID-19 and if you have also measured your blood level of vitamin D. Let us know all of this in the comments below, and let's have a very interesting and meaningful discussion. Also, I wanted to mention that you can find a lot more very useful and interesting information on the stanbridgescientific.com website, where I will be adding more and more information and videos also every week. So go and have a look. I will also be adding videos and data on vaccine side effects and mortality due to COVID-19 vaccines, which, as you know, cannot be discussed on YouTube. And so I decided to just put this information regularly on the stanbridgescientific.com website under the COVID-19 tab. So go and have a look if you have not seen it yet. And you can also add your comments directly there. Okay, so we can also start a discussion on this website as well. So thanks a lot again for checking these videos and for liking them. And I will see you in the next video.